Hello everyone and welcome back to our IPC In Action podcast.
Give it its proper name, Fran.
I know. So this is our November edition. So I'm Fran, I'm one of the infection control nurses.
Hi everyone, welcome back and thank you for listening to another edition of IPC In Action. And my name's Jen, I'm one of the other IPC nurses.
So before we start, so Jen and I were at an infection prevention and control national conference the other week. And
Which is as cool as it sounds, by the way.
It really is. It's actually very interesting. So, don't knock it. So we were just thinking and saying we had a lot of lovely conversations with loads of lovely people, and we had a poster for our podcast because we did a little bit of research into it on how it influences education. So we had a lot of people scanning our QR code on our podcast. So if there are any new listeners out there from across the country, just want to say welcome and thank you for coming to chat to us. It's really lovely to meet you all. But yeah, let's jump into it. So today, Jen and I are going to be talking about Clostridioides difficile, or C.diff, if you will. So just as this is obviously it can be a big issue, and a lot of the time it is a big issue.
And a huge topic within itself.
Exactly. So we thought we would do a whole episode on it because a lot of the time there is confusion about it. So I'll hand over to Jen just to kind of introduce what it is. What is Clostridioides difficile, Jen?
So for the purpose of the podcast and our sanity, we're just going to refer to it as C.diff from this point onwards. So C.diff is a bacteria. It is can be found completely harmlessly in the gut of approximately 5% of the population without actually causing any issue, without causing any diarrhea. Now, these people can just be termed as carriers, or they can just be sort of colonized with C. diff, which just is meaning it is carried in their gut but not causing them any harm or any ill effects, symptoms, etc. So when it becomes a problem is when the levels of bacteria in your gut can become disrupted, whether due to illness, any sort of long-term conditions, medications, typically antibiotics. They can really disrupt that sort of the levels of healthy bacteria and gut flora. This can then allow the C. diff bacteria in your gut to multiply and start to potentially release toxins, which can give you pretty unpleasant symptoms, and it can make you really quite systemically unwell.
Absolutely. I mean, it's, as a lot of staff members know, there is a very particular smell to diarrhea caused by C. diff, so a lot of the time you kind of know.
Yeah, it's got quite a distinctive whiff to it, which, some people are quite familiar with.
Yeah, absolutely. And obviously the symptoms that start off are they are pretty much the main reason as to why people can catch it so easily, and it's not just in hospitals, it can be caught anywhere. So how do you catch C. diff? So basically, when you have diarrhea, spores can be transmitted into the environment and they can land on surfaces. Now, if a patient, touching all of the environment, it can be contaminated by these spores. And then if that patient picks them up on their hands and they do not wash their hands with, hand gel or actual hand washing or even patient wipes, and then they go to have something to eat and they're using their hands to eat, then the spores can be transmitted and ingested, exactly, through what we call the fecal-oral route. So they're going directly into the digestive tract. So that's why we're as a team, so pernickety about, how effective it is, because they can just be anywhere in the environment and so easy to pick up. And
they're a really hardy little spore. If left to without cleaning, they can survive on a surface for, I think it's up to about 6 months.
Yeah, exactly.
I think it can be longer actually.
Yeah.
They are a hardy little so-and-so, and they can survive for a long time, which is why we really want to push cleaning with the peracetic acid wipes, but we'll come to that later.
Definitely. And, that's not just, as we were saying, just, it's not just bed rails, it's not just call bells, it can be toilets and, OBS machines, IV stand, literally anything.
Any surface.
So it's just something to be aware of.
So the people most at risk of getting C. diff are people in the sort of age category of over 65 years. We know that they are slightly more at risk. They have a slightly less functioning immune system. Anybody who is taking or have recently taken antibiotics, just because, as I've already mentioned, it can disrupt that gut flora. People who are immunosuppressed, whether that be by medication or by condition. For any cancer patients, anybody taking immune modifying therapies, etc. And just spending a long time in hospital does increase your risk of picking up not just C. diff, but other potential healthcare-acquired infections. Some of, the reasons of which Fran has already explained with the environment becoming contaminated. Any serious underlying illnesses, and specifically any procedures or surgeries that involve the gut, just for the same reason. It disrupts the normal function of the gut and can disrupt the production of those healthy bacteria.
Yeah. So it's quite a big group.
It is quite a big group,
especially in hospital.
And it's unfortunately for a lot of our patients, they actually fall into a lot of those categories, which then increases their risk dramatically of getting C. diff.
Exactly. And now for everyone's favourite parts, what are the symptoms?
Yeah.
So, as we kind of said earlier, as I'm sure we're all aware, that the most common symptoms of C. diff are regular bouts of watery diarrhea. So typically, most people with C. diff have around 3 to 5 bouts of diarrhea a day. And again, as we said earlier, this can have a rather unpleasant smell, and sometimes it can contain mucus and blood. But, when somebody is suspected to have C. diff, they have to be assessed in terms of their severity. So if the C. diff is severe, then bouts of diarrhea can be even more than that, sort of like up to, 10, 15 bouts a day, which, putting yourself in a patient's shoes, like that is horrendous.
Yeah, and it has, and it obviously has the side effects of, and which is a really important reason to have that sort of holistic approach and assessment of your patient, looking at the whole picture of, are they becoming dehydrated? Are their electrolytes becoming deranged because of that huge loss of fluid?
Exactly. So other things that that patients might experience might include stomach cramps, fever, nausea, sometimes vomiting, and loss of appetite as well is definitely a big one that we see. So, as Jen was saying, loss of fluids, keep an eye on that. So what we would, recommend for any patients in this scenario is to keep upping fluids and making sure they're drinking.
Monitoring their fluid intake and considering a referral to the dietetics team.
Absolutely.
But we can come to that.
So again, I think we'll come on to it, but obviously the severity of C. diff can be quite wide ranging. So we'll come on to that when we talk about diagnosis. So some things to look out for, Jen.
So something we would is a helpful prompt for ward staff to follow, and hopefully is available in sort of sluices and dirty utilities as a prompt, is the site mnemonic. A helpful sort of prompt for considering if your patient may have an infectious cause to their diarrhea. So the S is suspect. So if you're suspecting that your patient has, they've had some unexplained bouts of diarrhea. I is isolate. We need the patient isolated as quickly as possible to prevent that environmental contamination and prevent more people becoming potentially coming down with a C. diff infection.
Yeah.
Gloves is G. Gloves and aprons. We need your PPE. We want people to be wearing gloves and aprons when they're coming into contact with the patient. If you're just popping in to put a cup of tea on their bed, on their bedside table, that's absolutely fine to just pop in without PPE on. But if you're going in to provide any care, you must wear your gloves and aprons, please, guys.
Yeah.
H is hand washing. Does alcohol gel kill the spores in C. diff, Fran?
No,
it does not.
No, it does not. As we said, they're very hardy little.
Yeah, so-and-sos. So hand washing with soap and water is the best way to decontaminate your hands. And T is for test. We need to test somebody's stool sample to check for the presence of whether or not they're a C. diff gene carrier or whether or not the toxin is present.
So that leads us very nicely onto how is C. diff diagnosed. So, as obviously Jim was just saying, testing. So as you're going through and using the site mnemonic, you know your patients best. If there is something different and they are having watery diarrhea, don't hesitate to test.
Yeah.
You've got to get your stool sample obviously in the pot about quarter to halfway filled. As we said, you can take it from the bed if you need to. From bed pans, it can be mixed with urine.
Yeah.
Any of the above, really.
Yeah, it
Just
doesn't
making
matter
sure.
if you might consider that sample is contaminated.
Exactly.
It's already a dirty sample.
Absolutely.
It doesn't matter if it's come off the floor, out of a pad, like Fran has alluded to. The only thing you can't do is get it directly out of a toilet bowl.
Yes.
But from a commode liner is absolutely fine.
Yeah.
Like Fran said, whether or not it's mixed with urine, it doesn't matter. The lab will process it.
Yeah, absolutely. So don't hesitate to do that, because it's very important that it's identified as soon as possible if there are any changes in your patient. So they are obviously sent to the lab, and the enterics bench will be testing them for C.diff toxin. So it usually takes around 24 to 48 hours for these results to come through, and then one of our microbiologists will check the results to see if it actually reflects a genuine C.diff case or whether there might be another cause of diarrhea. So that's obviously always something to consider as well, because there could be a number of different causes for diarrhea, but that is one of the main.
It's definitely worth considering that so first off, the lab won't process a formed stool, so it's got to be diarrhea. It's got to take the form of the container that it's in for the lab to process it. Otherwise, it will be rejected.
Yeah.
Another thing is, if your patient has had some laxatives, for instance, laxatives shouldn't cause diarrhea. They should, if somebody has been severely constipated, there is a chance they might have some overflow. If you're concerned, and if it's different for your patient, just send a sample.
Yeah.
Because it's better to know than consider. It's better to know than not know, really, isn't it?
Exactly. Yeah. I wouldn't say, there's anything as like being overcautious.
I don't think so. So if you sent a sample, say on the 10th of the month, and it came back C.diff negative, but the patient continued to have diarrhea, the lab wouldn't process another one until 5 days later. So you could then send one on the 15th, that would then be processed again. And it's definitely worth doing that, because there is a chance that it just wasn't picked up in the lab on that initial sample. So if 5 days later somebody is still having diarrhea, please send another sample.
Yeah.
If somebody is positive, do we need to send more samples?
No, you don't need to send any more samples. I mean, once they are tested positive, we assume that they are positive and their symptoms are related to that. So that's where we come in our infection control nurse role. So we would then pick up the results, so they usually come through to us, and then, or sometimes you might see them before we do, or if it's at the weekend, then one of our microbiologists will call them through to the ward. So we start off as infection control nurses coming to do a review of the patient, and that's looking at things like their eating and drinking, whether they've got any stomach pain
or distension.
Yeah, exactly. Looking at how many stools they're having a day and what type they are. Again, that's where it comes in. Documentation of stools on the Bristol stool chart is the very best thing you can do to help yourselves and to help us as well.
Yeah,
because it can be incredibly hard to kind of judge where a patient's at, because we don't see the stools, you guys do, and we need to know kind of where they're at in
we need to know where they're at the beginning. We need to be able to assess that severity.
Yes.
And the number of bouts of diarrhea that they're having forms part of that assessment.
Yes.
And then we need to see how they're progressing, whether or not they're responding to treatment, or whether or not we might need to consider upgrading their treatment or changing their treatment.
Yeah.
So that's why the documentation is really needed. And
Absolutely.
if you, like Fran said, if you could use the Bristol stool chart on EPR, it really helps us out.
Yeah.
Because you can really clearly then see if that type is changing, if it's becoming slightly less watery and becoming more formed. It's a really helpful way of us seeing whether or not they're improving.
We love people that use the Bristol stool chart. So, and then another thing that we are looking for as well is we're looking at bloods most recently taken from patient, looking at their inflammatory markers, so their C-reactive protein and their white blood cell count as well. So that kind of forms our part of the assessment. And from what we do, we come and visit them at least every 3 to 4 days, just to see their progression.
How they're getting on.
Absolutely.
We're also looking at any medications that they're on that may need reviewing as a result of the C. diff diagnosis.
Yeah.
So it's not always the case, because some patients require it despite the C. diff diagnosis, but we might review or change some medications, such as any PPIs that they're on. If they're on any omeprazole, it might be clinically significant enough that they need to stay on it. A lot of the time that can actually be stopped until they have recovered from that C. diff. Just omeprazole is another one of those medications that can disrupt your gut flora, and it will it can make C. diff symptoms worse.
Yeah, absolutely.
Again, also looking at any antibiotics.
Yes, exactly. So what are the kind of treatment methods that we use?
So, first line treatment, we do not use oral metronidazole anymore, folks. Get rid of it, please. So, first line treatment is vancomycin. That is your bog standard. That's where you first go with a C. diff infection.
Yeah.
If somebody is they are found to have severe or life-threatening C. diff infection, they might at that stage have an increased dose of vancomycin, with the addition of IV metronidazole, but it is never given orally anymore for the treatment of C. diff.
Absolutely.
So the full sort of prescription guidelines for treatment of C. diff is available on Microguide, which is an easy to download app on your phone, and is a very, very helpful resource for antimicrobial guidelines. So first line is vancomycin. If vancomycin doesn't work, or it's not improving their symptoms within sort of 3 to 4 days, we would then want to upgrade to a drug called fidaxomicin. Now, fidaxomicin is a really, really good drug, and it also prevents the chance of a relapse. So, unfortunately, some people can relapse. When they've recovered from their initial C. diff infection, there is a 10% chance that they will have a relapse. Fidaxomicin is, as I've mentioned, a really good drug because it can lower that risk of having another relapse. So it is a really good drug for that. Both vancomycin and fidaxomicin, they're both a 10-day course. And again, the prescribing guidelines are available on Microguide. Another treatment that is fairly new, it's actually not new at all, it's actually really, really old.
Super old.
Is FMT. So it's a fecal microbiota transplant. So it's essentially a transplant of a healthy donor's feces into somebody with C. diff.
Yes.
And it is moving all of that healthy and good bacteria
To line.
Into the gut of somebody with C. diff. It is also being researched into using it for other conditions. So you have to watch this space on that. But we are using it semi-regularly within the trust. It's done by the infection control team. So it's really, really good for people who've had 2 or more failures on either vancomycin or fidaxomicin. So that's the sort of eligibility criteria for having an FMT.
Yes. So the way that an FMT is given, and it's interesting. We'll put it that way. So a patient having an FMT either needs to be having an NG tube inserted, and the FMT, the sample comes in a little pot, and it is initially frozen, and it actually comes from Birmingham down on a blood bike, and it is initially frozen, and then we will defrost it, and it'll start to obviously defrost as it's coming down, and it will eventually be in a pretty much completely liquid form, almost water, like think of the texture of juice, I would say. And then it will be put down the NG tube by one of us. The alternative method is that it can also be given via
colonoscopy. So it can be delivered rectally as well. We haven't done that, and I don't think many places...
We have done one. You weren't there. I saw it. I know, I was there. So
My
that one was done. But then for that one, you need to have 2 lots of the FMT, just because it's
just from a volume point of view, different route.
So before an FMT is given, there has to be, just assessment as to whether it's appropriate for a patient to actually have that. And a lot of the time, the gastro team will be involved in that as well, because obviously they know the ins and outs. So, that's something that we need to consider doing as well.
But bear in mind, it is an available treatment for your patients. And it can also be for community patients. They can come in and receive it as a day patient. We've received people from outside of the trust and the community. We've had some people come in from Swindon for it. So it's a treatment that is available for anybody who is who's had 2 or more failures on your classic C.diff treatment.
Yeah, and although it might sound quite complicated, it's actually relatively simple and easy to do. So if anyone is interested in it, you're very welcome to come and, have a chat with us about it, or even come and see it if you want to.
Yeah, come and have a look when we're, give us a shout. You can always come and follow us when we're giving it to a patient. If they're an inpatient, we would do it on the wards. If they're coming in as an outpatient, we would normally use a side room on endoscopy that they are very kind and let us borrow.
Thanks endoscopy. So kind of going back to your kind of initial diagnosis of it, we also want to look at precautions. I know that Jen mentioned this in the site mnemonic earlier. So our main precautions would be enteric precautions. So as Jen said, gloves, aprons, hand washing, main bits, and we're making sure that you are removing your PPE when you're in the room, having it in the clinical waste bin in the room, and washing your hands before you come out, and then you can always gel your hands after when you're shutting the door, for example. And another thing that's also really important that we don't see as much of, and we understand it can be difficult, is issues with equipment. So if a patient is isolated in a side room, the ideal scenario would be that they would have, if they don't have an ensuite in there, that they would have a designated commode, that they would have obs trolleys in there that are just left in their room, because as we said, with the spores, they land on the environment very easily, and you don't want to be bringing that back out.
Yeah, we do understand that that's not always possible. If, for instance, you do need to be bringing equipment in and out of the room, it's just making sure that it is being cleaned thoroughly, using like a disposable blood pressure cuff that can remain on the bed of the patient.
Yes.
And just making sure that all of that equipment that comes out is being cleaned with our red peracetic acid wipes.
Yes, the red ones, please, not the green ones.
Not the green ones.
The green ones don't kill spores.
Yes.
The red ones do. So the red ones outside every
And they're
room,
the red
please.
ones that need to be activated by running under the tap. They are dry wipes that need to be activated by getting them wet under the tap and giving them a zhuzh to activate that peracetic acid within the wipe, and that will kill everything.
And making sure you're doing that regularly to any commodes as well, or if the patient has to use, for example, a toilet in the ward, making sure that the toilet and the sink, etc., is cleaned down properly with the red wipes.
So when it comes to, say, a patient is being discharged, there is no reason that they cannot be discharged home with C.diff. If they are having rampant diarrhea and they are systemically unwell, then obviously that needs to be monitored and treated prior to them being discharged.
Yeah.
But if they are managing and they are not medically unwell and they are safe to be discharged home, there is no reason why they can't go home with that C.diff diagnosis. You can have vancomycin and fidaxomicin as in tablet form that can then be taken as a TTO and go home with it. There are pharmacies, I think there's only about 4 in Gloucestershire, but there are pharmacies in Gloucestershire that dispense fidaxomicin.
So we also have the most wonderful like extended team, as it were. So we've got the community team, the community infection control team, and we've got our lovely colleague Regina. She works in the ICB, and she sort of deals with GP surgeries, and we also have the care home infection control team, or the CHIP team as we like to call them. So they are very much on hand to be able to follow up patients as they are discharged. So for
and
example.
support with those
Yeah.
discharges, whether it's like communicating with the care home teams or communicating with the GP.
Exactly.
They're
So
a really helpful resource for that.
so they will do their follow-ups, they'll check in with the patients, and they'll help them to, if they need any further treatment, they will help to arrange that. So they are always a very, very handy group of people to know, really. So we're very grateful to have them as our sort of discharge and onward steps, let's call them. Yeah, it's brilliant.
So another question we often get asked in hospital is, can patients receive visitors? I think people are sometimes a bit nervous about potentially transmitting infections to their visitors. The answer is yes, absolutely, you can have visitors. The only thing we would ask, there is no requirement for visitors to wear apron and gloves. We would just ask that visitors wash their hands when they're coming in and when they're leaving again.
Yes.
And just to be aware that the patient does have C. diff, so that they can also make that that call that they are happy to, of course.
Absolutely. And then another sort of topic is step down of any patients that have C. diff. I mean, we understand, again, the bed pressures and the need for side rooms. We're very much aware of that, and we try and help where we can. So our criteria for the step down of C. diff patients is that your patient needs to be 48 hours clear of any diarrhea, and we would class diarrhea as being type 5 to type 7, and they need to have evidence of a formed stool. So anything below type 5. So type 4, type 3, you know the stool chart. That's what we need to see for them to be able to
We need to know that diarrhea
down.
has resolved.
Exactly.
And if somebody has recovered from that C. diff, it's actually a really good idea to get them out of the side room, get them into a bed in a bay if they are recovered, but a fresh bed. Put them into a clean bed, then the bed and all of the equipment in that room can then be physically cleaned with the red wipes. It would then also need that HPV process, that hydrogen peroxide vapor, which forms part of our red clean, following the physical clean. And that would just sort of fog the room to just kill off any final spores that are lingering on any surfaces.
So that's really important to make sure that it is done to prevent any further healthcare associated infections. So we need to really be requesting those and being aware that when a patient is either discharged or transferred, that needs to be done as soon as it can be.
It's a service that's offered in-house. It's available 24 hours a day.
Yes.
So please contact domestic services to get that.
Yes.
I think that's kind of C. diff in a nutshell.
Yeah. So in a nutshell. So one other final thing, and this is when we get the result through, we always add an infection to the health issues section on EPR. So that is just so you're aware that patient has got C. diff, and it comes up as that little, that little bumblebee symbol on the front page. Symbol. Yeah, and that is also going to be present for then if a patient is readmitted into hospital at any point. This will flag up to yourselves, to us, that the patient has had a history of C. diff, and that perhaps we need to be a little bit more cautious, looking out for any signs and symptoms and sending a stool sample again as soon as possible. Yeah. So that is just a little nugget to be aware
just
of.
to be mindful if somebody's coming in, just to check those health issues and see if they have a history, and if they have any diarrhea, they definitely need isolating and a sample sent, like Fran mentioned.
So
I think that's it from us today.
So we kind of look at each other like, oh my gosh. So that was everything on the topic of C. diff. If you've got any more questions, we're very happy to answer them always. We know that it can be a bit confusing
and
sometimes.
It is a big topic.
Massive.
I don't think we have by any means done it full justice today.
I think we didn't predict how long this was going to be.
Definitely. But if you see us out and about, please feel free to flag us down and ask us anything. No such thing as a stupid question.
Absolutely. So our next edition of our podcast is going to be our Christmas one. Yay.
Ho, ho, ho.
Ho, ho, ho. So, yes, thank you for listening. And sorry, that's long, but I hope you enjoyed it.
Yeah.
So, as usual, if you need to get in contact with us, we are on extension 6122 for Gloucester and extension 3129 for Cheltenham, and then your regular routes for contacting microbiologist at
or the site team.
Or the site team.
Yeah, out of hours.
So thanks for listening, and we will see you next month.
Thanks, everyone.
Bye.
Bye.